CDC reporting that 1 in 50 kids has autism. That's up from a previous study that claimed 1 in 88 suffered from the disorder.
Health officials say some milder disorders are being diagnosed, which impacts those numbers. Joining us right now from Autism Speaks is Michael Rosanoff. Nice to have you here.
Thank you for having me.
Let's talk about this new surveys, the new stats. Does it mean that there are more kids with autism?
It's an interesting question, and what this study is showing us is that we're getting better at detecting autism, but this 1 in 50 number does not replace the CDC's official estimate of 1 in 88. What it is telling us, though, is that the 1 in 88 is very likely an underestimate of the true prevalence here in the United States.
So where do you think the true number lies? Is it closer to 1 in 88 or 1 in 50?
I wish I could answer that question, but what we've seen from research around the world, a study in South Korea showed us that the prevalence when you go into classrooms and screen directly was about 2.5%. So this 1 in 50 or 2% is closer to that number. So we think we're moving in that direction. We'll see when the CDC releases their latest official statistics.
Why are there more boys that are autistic than girls?
Another very good question. It's interesting that there's a consistent 4-to-1 boy-to-girl ratio in all of these studies, but research has not uncovered the reason for that difference. And we need more research dollars to help understand some of that, as well as some of the causes of autism and how we can better treat autism.
Yeah, I mean, you hear so much about it. What do you think about there's been so many pet theories, and people have started almost making up their own reasons why there's more. Do we not get vaccinated? There seems like there's been a lot of junk science about it, you know.
The reason is because there really is not enough federal funding for research to look into these issues. We know that prevalence has increased over time, and things like better detection, better awareness cannot explain that entire trend. What else is working here are different factors, environmental and genetic, and their complex interaction that we still need to uncover, and really more research is what's going to allow us to do that.
So you really don't know at this point. Now, I'm also wondering about the autism spectrum, because I know at one point they were talking about adding other things to the autism spectrum like ADHD. Is that why the numbers are different right now?
Well, what's interesting about this study is when they did it 4 years apart, they found prevalence increased, and it was because some of the more milder cases were being detected. What that means is doctors, healthcare professionals are getting better at detecting it. However, it's happening too late, and there are still many families out there that are going undiagnosed. If they're not getting diagnosed, they don't have access to services, and that's something we need to change. We need an appropriately scaled public health response to manage this public health crisis.
Now, I know autism awareness is coming up pretty soon, April?
It is. So although the findings of the study are alarming, the timing is just right because April 2nd is World Autism Awareness Day. It's an opportunity for the community to come together as one strong voice to shine a light on autism. We have a campaign called Light It Up Blue, where we ask our community to light their homes and schools and businesses in blue light and landmarks to help raise awareness of autism around the world.
And also the pin you're wearing right there, the puzzle piece.
That's it right there. I hope to see a lot more of these out there.
All right, so parents who are sitting at home and hearing these numbers, alarmed, should they get their kids vaccinated? You know, what should they do? What advice would you give somebody right now?
I think a study like this tells parents that they're not alone. There are many other families out there that are experiencing these challenges, and what would be most helpful would be coming together as a common voice and helping to lobby our government to develop a national strategic plan for autism that allows accessible and affordable care for families.
Michael Rosanoff, thank you so much from Autism Speaks.